don't know how we could do that anyway. So that has a lot to do with why certain problems are so difficult to treat. We're not treating a problem, we're treating somebody's solution.
Ella H. started the interview by spontaneously commenting on the threat she felt when her psychiatrist recommended bariatric surgery to treat her obesity and offered to sign the necessary paperwork to have Kaiser Health Plan pay for the procedure.
Can I get comfortable first? And then he says, no. He says, when drug addicts come, we take them off the drugs first. And he would take me off of my drugs. Food was my comfort. Food, I coped with life. I cope with life with food. And it's really strange tonight. I guess the Prozac's helping, because when I'm taking the Prozac, I will lose a little bit of weight. And I just feel that he was taking away my safety. And so I decided not to even bring the paper to the doctor and have it done, because I'm not ready, I don't think, to get the weight off and know that I can't gain it back and can't be safe again.
This is another patient who was heavily molested as a kid. She treated that by smoking 3 packs a day, and she was thin until at age 35 her husband convinced her to stop smoking for her health. And she explained to me that 3 pack a day smoking keeps people at a distance. I haven't thought about that. But, seems plausible. So when she stopped smoking and she began attracting male attention, which she had no experience with handling, it was quite frightening to her. And she quickly gained from slender to 300 pounds. And went into acute respiratory failure because her lungs had been progressively damaged by the 3 pack a day smoking. But as long as she was slender, she was able to tolerate that. Going to 300 pounds, she couldn't handle the extra load, so she had to go on 24-hour-a-day oxygen. Some years later, she came into the weight program and we took her weight down 150 pounds, and she no longer needed the oxygen. And again, we initially thought, oh, great success. Well, the return of male attention was quite threatening still, and she consciously regained the weight, accepting the return to 24-hour-a-day oxygen. Listen to what she has to say about this, because it's really quite memorable and extraordinary.
Dozens of pages altogether. And on the very next to the last line, you said something that I thought was extraordinary. Let me read it to you, because I think it's remarkable. I believe smoking 3 packs a day and weighing 300 pounds are not the problem. They're the symptom. Took us a long time to figure that out here, and you just actually dropped that. There's no sense. So you are in respiratory failure on 24-hour-a-day oxygen.
Yes.
Major amounts of weight, overweight.
Yes.
And you demonstrated, or we demonstrated together, a couple of years ago, that when you had a major weight loss in the OptiFast program here, that your need for oxygen disappeared.
That's correct.
So that if you lost 150 pounds approximately, the need for oxygen would no longer be there. The weight came back. Most people have very little understanding of why people get fat or regain. I mean, they're stuck with this simple belief, don't you know it's bad for you, etc. And people tend to know even less about smoking.
Yeah.
It's labeled an addiction, and as though that somehow explains it.
Right.
Something happened to the sound there.
Yes. I think I've come to that conclusion. It hasn't been quite immediate. It's come to me over the last few years of analyzing just exactly where I've been and what I've done. Obviously, I was a 3-pack a day smoker when I was thin. I didn't have a weight problem until after I was 35. But I've done several OptiFast type things, and I finally came to the realization on my own that the reason I put the weight back on was to protect myself.
It's a very big idea. Moments later, she begins talking about chronic depression. Most people speak of depression as a disease, and they say it's genetic. Some say it has to do with a chemical imbalance. Something to be said for each of those. But here's another thought. What if depression were not a disease, but a normal response to abnormal life experiences? And here's the evidence for that. If we look at the prevalence of self-acknowledged chronic depression in over 17,500 middle-class, middle-aged adults, and its relationship to childhood experiences, here's what you see. Women in red, men in yellow. As the ACE score goes up, at ACE score 4 and higher, you're bumping the prevalence of almost 60% in women, and 35% in men. We looked at suicide attempts. This is really a steep increase. At ACE score 6 or more, again, it doesn't fit on the graph because it's so wildly above. At ACE score 6 and more, the likelihood of attempting suicide runs between 3,100 and 5,000% greater than the likelihood at ACE score 0. We looked at rape, which I once naively thought was fairly uncommon. As the ACE score goes up, the likelihood of rape goes up in a very clear dose response curve. The real question is, how does this work? How does what happens to a little girl affect the likelihood of being raped later in life? You can ask me questions, but that's one I'd like to ask you, so don't forget the question. The implications of the answer extend far beyond rape. Oh my goodness. We looked at the relationship of ACE score to self-acknowledged hallucinatory activity. The missing slide. This slide shows that at ACE score 7 and higher, the likelihood of self-acknowledged hallucinatory activity is 10%. Whoever would know? Of course, you have to ask. Everybody can know. Crazy, you can't ask patients questions like that. But we're curious. besides this person comes from a good home, and so on. But how else would we know other than by routinely asking? We looked at the relationship of ACE score to high-level promiscuity, which we defined as 50 or more lifetime sexual partners. And ultimately, I came to see that this slide might better be titled Looking for Love. Maybe the next one is the one who's got a love name, if not, surely the one after that. And sometimes, when relating to one's peers is too threatening, that hope will be fulfilled by a child, or by photographs, or by a farm animal. We looked at the relationship of ACE score to unintended pregnancy and to elective abortion. Okay. Now, unintended pregnancy is usually written off as an accident, and what we found is like most accidents, they're not totally accidental. Interestingly, we found that miscarriage also turns out to be proportionately related to the ACE score. How does that work? That's beginning to shift us into biomedical disorders now. When we looked at liver disease, we saw a clear relationship of underlying ACE score to liver disease many times later in life. Initially, we thought, oh, well, you know, if you're going to buy street drugs, you're going to get chronic hep, but if you're going to drink, you might get alcoholic liver disease. That seemed adequate until we learned more. We looked at heart disease. Now, since the Framingham study, everybody in the country knows that there are certain risk factors for heart disease: smoking, diabetes, cholesterol level, etc. Most people don't know that 12% of cases of heart attack do not have any of these underlying risk factors. And the question then becomes, well, how did they get it? And when we looked at those 12% who don't have any of the recognized risk factors and matched them against the 10 categories of ACE score, we saw a relationship to each of them. But how does that work? Well, it turns out, and this is all fairly recent information, that chronic major unrelieved stress causes the release of pro-inflammatory chemicals, sometimes called pro-inflammatory cytokines. They cause inflammatory changes in the lining of blood vessels. The very smallest blood vessels, microscopic blood vessels, those inflammatory changes of the lining cause the vessel simply to shut down totally and turn to scar tissue, whatever piece of organ they had to supply blood to. Our first patient, Patty, died at the age of 42 of primary pulmonary fibrosis, an ordinarily quite uncommon disease where a person's lungs turn to scar tissue. She'd never been a smoker, had no exposure to air pollution. In recent years, it's become clear that some has yet to be determined fraction of primary pulmonary fibrosis cases are due to the release of these pro-inflammatory chemicals. In larger blood vessels, those chemicals cause changes in the lining of larger blood vessels such that it has like a magnetic effect on cholesterol, causing cholesterol to precipitate out in the lining, causing cholesterol plaques, obstructing blood flow that way. Interesting story here. Pretty much everybody has heard of statins, cholesterol-lowering drugs, remarkably effective at reducing heart disease. And the explanation is that they lower cholesterol. And that's true, they do lower cholesterol. But it turns out that that's not the main effect statins is an anti-inflammatory effect. So they reduce the likelihood of cholesterol depositing out from the lining of blood vessels. Well, that's very interesting. That this anti-inflammatory idea is a big deal. And it even turns out to be the main mechanism by which statins work. He's an interesting patient. She's a woman is articulate, well-dressed. She holds a responsible position in a major university. You know, she's obviously doing well. She's just the kind of person that we not seek an abusive childhood history. Of course, we skip such a history for our own comfort. We were smart enough to say that, you know, we saw no need of upsetting such a patient who's clearly doing well. So listen to what she has to say about this. Her name, by the way, is on the slide at her request, because she doesn't want what she has to say to be minimized by anonymity. I must say that, you know, 25 years ago, I totally dismissed the idea of childhood experiences being related to subsequent malignancy. In her mind, there's no question about the relationship. She doesn't have an explanation for it, but somehow she's quite confident about that. We'll come back to the point in a moment.
Can you tell just by looking at me that I was an abused child? Can you tell that I was sexually abused routinely, that I was neglected, starved, beaten? Probably not. You would have to ask in order to find out, and that's not the sort of thing that people typically ask about. The downside of having this kind of childhood is that it translates into health problems in adulthood. At least in my situation, it seems to have done. I'm now recovering from my third battle with cancer. Not the same cancer, 3 different kinds of cancer. I've had chronic pelvic pain, migraines, the whole laundry list of medical complaints, all of those sorts of things that are very difficult for physicians to figure out. Growing up that way instills a constant fear, a constant state of turmoil that's just under the surface of a veneer that's fairly thin. Little things become scary in an atmosphere like that, and once you've internalized all of that, it's very difficult to let go of it.
So how does this work? You know, are easy, yeah, we smoke 3 packs a day now. She was never a smoker. And that was not one of the kinds of cancers she had. Well, it turns out that we've really known pieces of the explanation for a fair number of years now, but never put the pieces together. We all know that if you get an organ transplant, you have to be on lifetime immunosuppression. Many of us will have heard that one of the side effects of lifetime immunosuppression is an increased risk of malignancy at some point in the future. Well, okay, you know, if I'm going to die of kidney failure next week, give me the kidney and I'll worry about, you know, 15 years from now, some other time. The question is, how does that work? Well, we all are producing a very small number of cancer cells every day. Our immune systems process them out and destroy them. We never know the difference. So getting cancer means either that the rate of production of cancer cells, for whatever reason, is increased above the ability of our immune systems to process them out, or our immune systems are suppressed so that they can't handle even the normal low levels of production. Well, again, another piece of recent knowledge. That is the chronic major unrelieved stress, even though its origin might have been 50 years ago, is now known to hyperstimulate certain areas of the brain to control the function of the immune system and chronic major unrelieved stress now has a recognized side effect, immune system suppression. So the question simply becomes then, well, does it matter whether your immunosuppression comes out of a prescription bottle, as it would with an organ transplant, or out of chronic hyperstimulation of pieces of your own brain? So these are remarkable linkages. We looked at other factors, relationship of ACE score to the likelihood of being a perpetrator of domestic violence. We're used to thinking of women as the victims of domestic violence, but that's merely because their victims were typically their children, who are not much of a position to make it known. I would say it's essentially the same. We looked at how this plays out in the workplace. Relationship of underlying ACE score to absenteeism, to having self-acknowledged serious financial motivation. It's kind of like poverty as an outcome rather than a primary underlying cause. Isn't that interesting? Maybe that has something to do with why the very well-intentioned war on poverty was not effective. Having serious problems performing my own job properly, self-acknowledged. So toxic environments are real enough at some work sites, but not nearly as prevalent as toxic childhood playing out decades later at those work sites. So ultimately we saw, as I said originally, adverse childhood experiences determine the likelihood of the 10 most common causes of death in the United States, and the risk factors for the 10 most common causes of death are the things that we've been discussing all along. With an ACE score of 4 or more, the majority of adults have multiple risk factors for these diseases or the diseases themselves. But, I mean, this is the making of big medicine, exciting stuff like coronary bypass surgery or lung or liver transplants or bariatric surgery. It's so easy to become intrigued by the technical wonders of these procedures that we never discomfort ourselves by seriously asking why those problems occurred in the first place. We saw that many chronic diseases of adults are determined decades earlier in childhood, not by diseases of childhood, which once was the case, but by life experiences. You know, polio is gone, rheumatic fever is gone, diphtheria is gone, pellagra is gone. This is really interesting. So whooping cough is gone. It's really an interesting change. We've moved from chronic diseases of childhood, like the ones I just illustrated, now to life experiences in childhood. And the risk factors underlying these adult diseases oftentimes are effective short-term coping devices. Smoking, drinking, buying antidepressants on the street, etc. It's hard to give up effective short-term coping devices, particularly at the request of someone who has no idea of what has gone on. And there is a public health paradox that many of our most common and difficult public health problems are also unconsciously attempted solutions. Personal problems that date back to childhood, that are buried in time, that are concealed by shame, by secrecy, and by social taboo against speaking about certain kinds of things. Nice people don't talk about certain things. Most of us try to be nice, allowing monstrous problems to remain comfortably unrecognized. So we found that adverse childhood experiences are the main cause, so-called health risk behaviors, biomedical disease, of disability, of premature death, and obviously healthcare costs. And about 2 years ago, we published a paper showing that at age 4 or 6 and higher, the shortening of life is almost 20 years. So why is this so difficult to deal with? Well, here's part of an explanation. These are PET scans of the brains of 2 3-year-old boys. A PET scan is a very sophisticated kind of X-ray procedure where biochemical activity is superimposed on anatomic structure. And this is an ordinary American kid. This is a 3-year-old boy taken from a Romanian orphanage. Institutions that were noted for the extraordinary levels of neglect imposed on the inmates. And what you see here is large areas of brain where there's no color, where there's no biochemical activity. I don't think it's a Paxenius imagination too much to think that maybe at age 3, when the brain is being formed, that lack of biochemical activity is going to affect the kind of brain that's being formed. In other words, what we're looking at is the translation of life experience into neuroanatomy, and maybe that has something to do with why these things are so long-lasting and difficult to deal with. So I'll summarize what we've said thus far this way. We have this huge base of adverse childhood experiences, mainly unrecognized. We realize now